This is the first video in a series of recordings of the sessions which have been delivered by Dr. Chris Morris at the Mars Education Forums to support training activities as we introduce Mars at the PA. When we think about Mars, we currently think about planets or even chocolate bars. By the time you finish your training and by the time we go live in 2017, Mars will have a completely different meaning to you. So Dr. Morris's first session was all about what is Mars, what does it mean for us at the PA, and he gave some demonstrations about the system. Each information session and each video to follow will focus on different topics. MARS stands for Medications or Medications Management, Anesthetics and Research Support. So these are currently elements that are not part of the patient's chart in the current release. When we go live with this release, medications, anesthetic documentation and research information will all interface into the patient's chart, making the patient's chart one source of truth. So we don't have to look in different areas for information about the patient. Residents and registrars are being heavily trained because they're the main prescribers in the hospital. They are working in the hospital after hours, so when there's not as much support available to you for assistance, so that is why the residents are being trained as super users so that they're able to offer support broadly across the hospital. It's a great way of spreading advanced knowledge more evenly, and it's just a way that we can support and help each other as we transition into electronic ordering. The residents are more readily available to help colleagues and seniors as well. So the residents do receive a higher volume of training in that they receive the 4-hour training session, the practice lab, the proficiency, and also these weekly education forum presentations. So the 4 hours of training that you'll be receiving is only going to cover the functionality of the system. There is a lot more to learn than purely just functionality. So Dr. Chris Morris has developed the weekly sessions to give you a more fuller knowledge of actually implementing the functionality into day-to-day activities. The training sessions will show you how to use the system, whereas Dr. Morris's sessions will show you how to implement the functionality into your actual role and day-to-day activities. The training sessions are predominantly run by a training officer from the digital hospital team, a clinical nurse and pharmacist. Now, as the trainers are very knowledgeable in the system itself, they do not have they're not prescribers, so they do not have the day-to-day knowledge of what you do in your role. So your admissions, your ward rounds, your outpatient clinics, for example. So there is a little bit of a limitation in what questions can be answered by your trainers regarding your day job. So this is why the forum is such a valuable resource for you, because it's interactive and you have the opportunity to ask Dr. Morris questions as you think of them, and just to be able to be answered by a medical officer. Mars is quite a way away still. We still have a couple of months before we go live. And the question has been asked, why are we delivering training so early on? So the first point on the slide here was written by Dr. Morris. He's still learning things he didn't know about the current release after 18 months. So there's always things to learn. There's always new knowledge to be gained. And as they say, practice makes perfect, and it's highly recommended that you do practice using the system as much as possible. So it's best to complete your training as early as possible, so it gives you more window of opportunity for practicing. Poorly done documentation and pathology is dangerous in the current release, but poorly documented medications is a whole other level in terms of patient safety. So it's so important that we train early, we practice lots, so that we're ready to go when we roll this release out in the new year. There are things that you can do in preparation, such as practicing, and practicing. There are some issues that we currently have in the current release. So R3 is release 3, and we can start looking at that now as we prepare for R4, which is release 4, which is Mars. Across the hospital, we've got issues with encounters, specifically encounter selection, selecting the incorrect encounters and documenting in the incorrect encounter. We need to pay more attention to allergies And as we move into release 4, there's going to be a lot more information available to us. So we're going to show you how you'll be able to set up your favorites to quickly access your readily used orders. And power plans is a big feature in the new release. So that is something else we'll touch on in this video. Medications are encounter specific, so if you're in the wrong encounter, the medications will not be recorded into the patient's current encounter. So this is a real problem. It's a problem now, incorrect encounter selection, and getting it wrong with medications is a risk to the patient. So, and it also means more work for you, as you'll have to re-prescribe in the correct encounter. We recommend you use your patient list wherever possible. If your patient is an inpatient, for example, or you're in the current encounter in an outpatient setting. If you are looking for the current encounter, you're best off to use your patient list, which I will demonstrate in this video. And banner bar. There's a lot of valuable information on the patient's banner bar, such as the encounter that you're in. So if you can get into the habit of checking the encounter on the banner bar, you will never go wrong. Allergies is another area where we will be retraining in, and I will be demonstrating this shortly for you. Allergies are currently in the system, and currently we use the allergies purely as an information source. We review them to see what allergies the patient has documented in their chart. However, as we move into the new release with medications, allergies become a lot more important, so too does the way in which they are documented in the patient's chart. The allergies that are documented in the chart are responsible for firing off drug and allergy alerts in the system. So it is absolutely vital that when they are entered into the patient's chart, we are entering them correctly so that the alert will fire. You'll see on the screen here, we've got what is Multum, what is a sulfur allergy. This is a really great example of how important it is to correctly document allergies. I'll talk more about this when I go into the system and demonstrate this one for you. We'll have a quick look at favorites. There's 68,000 order sentences in the system. If you've done your training so far, you'll know that an order sentence is the medication that you're ordering with the relevant information attached to it. So the dose, the frequency, the route of administration, all of that information. So with 68,000 in the system, you may find that you might like to save some of them as your favorites just to cut down on the searching. It is useful also for adding PRNs and taking care with out-of-date orders too. Power plans. A lot of people are not familiar with power plans at this stage. By the end of your training sessions, this short video, and by the time we go live, you'll know a lot more about them. So now I'm going to go into the system and demonstrate for you how we do the encounter selection, the allergies, and we'll look at power plans too. Dr. Morris set a challenge at the end of the session, asking for every patient that you see this week, review their allergies and ensure they're future-proof. So what does that mean? We'll have a look at that when we go into the system now and focus on allergies. This is a little small step that you can do to ensure patient safety as we move forward into the Mars release. Another challenge is always look at the banner bar. Just always check that encounter. Make sure they're in the correct encounter. And don't be a mate if there's anyone who is not actually following those rules. If you've got any questions, you can always email Dr. Christopher Morris at christophermorris@health.qld.gov.au. You can answer his survey and put your questions in there. And of course, the ideal way of asking your questions and getting your answers is to come to these information sessions, these education forums, and ask him face to face and get the information from him on the spot. So now we're going to take a look at encounter selection. So if you can think of as an encounter as an occasion of care, what the problem is with selecting the wrong encounter is it is very similar to opening up the patient's chart at a random section, and you could be documenting in an outpatient encounter from 6 months ago when your patient's right in front of you as an inpatient. So the information that you're documenting in the chart is not going to be visible to anyone else, and the orders are not going to, the medications will not appear on your electronic medications chart, which is called the MAR. When we are searching for a patient's record, we recommend that you don't just type in the UR number in the box up here. The reason being is this is a statewide bill, so it is possible that patients across the state can have the same UR number as another patient. So we like to do, we click on the magnifying glass, and wherever possible, we do 3 points of identification. So I'll put in the UR number, the patient's surname, and their first name. A lot of the problem has been that most of us know that we can double click on the patient's name and it will open the patient's chart, or you can click on any of these encounters down here and it will open the patient's chart. But the problem is a lot of the time across the hospital it's opening the chart to the wrong encounter. Very, very simple to select the correct encounter. Again, it's just a 3-point check. So we look down the bottom section of the screen here. This is where we're going to open the patient's chart. The first thing we need to look at is what type of encounter am I looking for? Is it a current inpatient encounter? Is it an outpatient encounter? A no visit encounter we never use because that just appears when the patient's chart is created. You might also see emergency encounters, renal encounters as well. So you can click on encounter type if there's multiple inpatient encounters, for example, and it will group them all together. That's your first check. What kind of encounter do I want to open? So let's say we wanted to open the inpatient encounter and our patient is in Ward 4E. In this situation, there's only one encounter here, so that's perfect. However, if they've had multiple admissions to Ward 4E, we would then need to look at a third identifier, and that is the date. The start date is when they were admitted. The end date is when the encounter was discharged, which means when the patient was discharged. So we can see here that the patient has not been discharged because there's no end date. This is still a current encounter. So if you always check the encounter type, the patient location, and the start time and the end date, you'll never go wrong. What you're seeing here is the first alert that you'll see that's been built into the patient's chart. This is an alert to make sure that the VTE prophylaxis power plan has been completed, and that's the power plan we'll take a look at shortly. This is just letting you know that it has not been completed, and it's giving that warning for you for patient care. I'm going to click OK, so I've acknowledged that. And I'm now going to be in the patient's chart. Excuse me while I just readjust the screen there. Okay, lovely. So, talking about the banner bar. Just to really drive the message home, we've got the encounter here in the top right-hand corner. Always check this encounter here to make sure you've opened the patient's chart at the correct encounter. If you ever haven't, you can simply click on patient information, go to the encounter list, and you can change through your encounters here if need be. We don't need to do that though because we are in the correct encounter. And now we're going to talk about allergies. So we can see the patient has a penicillin allergy. Then that's our first check. There's up to 5 checks that we can do to make sure that we're optimizing the use of MARS for drug allergy interaction checking. So the first thing I'm going to do is draw your attention to the allergies on the banner bar. So that's our first check. You can either click on the hyperlink to review the patient's allergies, or you can go through allergies in your doctor view or allergies on the patient's chart. However you currently do it will be absolutely fine. We've always seen this little tick here, but we've never had to worry about it. Now we do. As I expand this column, we can see that that column is DA for drug allergy, and there's a green tick. That is our second check. Does the medication that they could potentially have an allergic reaction to, will it interact in the patient's chart? If we see this tick, we know that the system is going to perform a drug allergy checking on this particular allergy. I'm going to add a new allergy now, and this is where I'll talk about the sulfur that you saw on the screen. This is a great example of a limitation of the system, and where your clinical knowledge will absolutely override the smarts of the system. So let's say our patient has got a sulfur allergy. currently we would see sulfur was here and it's showing up as an allergy, so we'd select that one. However, when we select it, we can see the vocabulary here just says allergy. When we select it, this is our third check. We're seeing this icon here, drug allergy checking is not available. So the system is not going to check this drug allergy. This has been entered into the system as a substance. So this is a substance allergy and only drug allergies will fire the alerts. If we see this icon here and this warning, then we know that that sulfur allergy is not going to test against sulfur-based medications. So that is our third check. So then we need to go back and look to find the correct sulfur allergy. I'm just going to finish this one off so that we can see how they look. See how this sulfur allergy here doesn't have the tick. So we know straight away that this allergy will not be doing any drug interaction checkings in the background. As I said, with it being a limitation of the system, sulfur, with this being an American system too, sulfur is spelt differently in America. So the sulfur drug is spelled S-U-L-F-A. And this is our fourth check, is the vocabulary. We need the vocabulary to say multum if we want the drug allergy interaction checking to occur. When we're entering drug allergies, we need to make sure that the vocabulary is showing as multum allergy. And now you will see that we're not getting the alert. So if there's no tick, it is a substance. If there is a tick, we now know that any sulfur-based drugs will be cross-checked against this allergy and fire off the relevant alerts. There's one other limitation to allergies, and that is with SAS drugs and custom-made drugs as well. They will not fire off alerts in the system. The system gives great decision support, but it's very important to really stress the fact that it does not override the need for your clinical knowledge. Next, we'll talk about favorites. So I'm going to place an order for diltiazem, and I'm going to show you just how many order sentences come up when we order diltiazem. So as you can see, when we order diltiazem, we get a lot of results. And this is one of the drugs that has the fewer order sentences. Sometimes you can scroll right across through several pages. So we can see here, these are order sentences here. So we can see the product at the top here, diltiazem 60 milligram oral immediate release tablet. And then below that we can see the details of the order sentence. So 1 tablet, orally 3 times a day. So you would select the relevant medication. If this is quite a regular one, you can right click and you can add to favorites. You can create a new folder, name it whatever is relevant to you, and OK. So now when you go to place your medication orders, we can see here you've got a folder. And you can just go in there and very easily select the orders that you currently use. Finally, in this demonstration, I'm going to introduce you to power plans. So what they are, how we use them, and why we use them. And I'm going to demonstrate this by using the VTE prophylaxis power plan, which we saw the alert for at the beginning. So the system gave us that alert saying that the VTE prophylaxis power plan hasn't been completed. So then we need to go in and complete that. So the system's quite smart in its searching now, definitely an upgrade from the current release. And here is our power plan. I know this is the power plan because this icon here is the power plan icon. So when I click on that, I'm going to order that power plan, close my search window, and it appears in the background here. This is what power plans look like. They can be single phase like this power plan is, or they can be multi-phase, which I'll also show you very briefly. Now that we've got it on the screen, what we can see is that a power plan is simply a group of orders and reference text for you so that you can organize and order your patient's care in the one place. The yellow information here are the comments in the yellow section, I should say, with the note icon. That is reference text, and that duplicates what is currently on the paper forms. You'll see here that there is a notifications icon which has chain links on it. Whenever you see this icon, it's letting you know that there's evidence-based information that you can click on. It is a hyperlink and it'll open up that information. Depending on what power plan you're using, it could be a scanned-in copy of the current paper clinical pathway. It could be a link to statewide guidelines, depending on what power plan you're in. The power plan will be broken up into different categories. So this one here has VTE risk assessment forms, patient education, and weight. So we can go ahead here and we can order these by ticking or unticking. You'll also see that we have the VTE prophylaxis orders here, which we can select or unselect. And we've got our medications down the bottom here. So we can order patient care activities, we can order tests, we can order consults, we can order medications, all as part of a power plan. We have the option to initiate and sign. If we were to initiate a power plan, we would be putting it into place straight away and then clicking sign to sign for all the orders. You also have the option of just signing the power plan so that you're going to be signing off on all of the orders in the power plan, and then it can be initiated at the relevant time for the patient. Very quickly, I'm going to show you a multi-phase power plan. I'm choosing the heparin power plan because this has a very heavy focus in our training activities. Didn't select it, sorry. Okay, let's try again. Great. This is a multi-phase power plan. So the power plan is here, heparin IV infusion order adult, and then it is made up of phases, and the phases are selected based on the care that you are delivering to the patient. So we can see here we've got the acute treatment of DVT or PE, we've got warfarin bridging, and each phase has different orders and different information in it depending on the treatment that you're delivering your patient. This one's quite a good power plan to look at. We can see that it's got dose range calculators. We can see it's got an initiating heparin section. It's then got a maintenance section if the patient's APTT falls within a subtherapeutic range. If the patient's APTT falls within the target range, we have the relevant orders for that treatment. And if the patient's APTT falls into a supertherapeutic level, we have that phase as well. So you initiate the phase that's relevant to your patient's care, and you place the orders that are relevant to your patient's care as well. That concluded Dr. Morris's information session. Please watch the next video in this series.